like to thank all my professors and colleagues for sparing their free time and delivering the excellent presentation so far. And as for today, as a first lecture, the title is going to be Perceived Injustice and Chronic Pain. This lecture, it's going to be presented by Professor Dr. Dominic Harmon. He's a consultant anesthesia and pain medicine in Limerick University Hospital, Bon Secours, Limerick, Professor, University of Limerick in 2006. He has trained in physiology, anesthesia, pain medicine, musculoskeletal medicine, and psychology in Ireland before pursuing a fellowship in chronic pain medicine and at the Walton Centre of Neurology and Neurosurgery, Liverpool, United Kingdom. He's the author of 5 medical textbooks, including evidence-based pain medicine, and he has published over 250 peer-reviewed papers from Patrick's Well, Limerick, the home of hurling. Please welcome Professor Harmon. Nice to have you here.
Thanks very much, Mohammed. Yeah, continue. So good evening from Limerick, Ireland, and I'm going to talk about this topic of perceived injustice and chronic pain. I think it's very important in chronic pain. I've been involved we've done several research studies on this ourselves, because I'm aware of all the background literature and I see the whole clinical importance of it. I will, even if you have an awareness about the relevance of perceived injustice and pain, I think I'm going to point out a few things you may not have thought about, even in terms of dealing with it, for example. Okay, so, and in reality, for example, probably most of us in our lives, we think about there are times when we feel we haven't been treated that well. And there are times when we haven't been. And so you can talk about like injustice. And again, for example, perceived injustice. That's an image there, just showing you again from Limerick, Ireland. And again, it's from the longest river in the British Isles. And here we have 2 what we call common gulls who are facing each other. So I mentioned that, for example, again, that injustice is very common perception in life, okay? And there's a part of it comes from a thing called the just world beliefs. So sometimes we believe that the world should be just. We believe that bad things shouldn't happen. We believe that people should get what they deserve, but that's not the case. If you're around this world for long enough, you see that things do happen that are unjust, okay? And of course, you can consider it as a violation of human rights. You can consider transgression status. You can talk about unnecessary suffering. You can talk about irreparable loss. This is across all societies and across all races and across all socioeconomic groups. Sometimes you might think, yes, it might be higher in lower socioeconomic groups if they feel more injustice, and maybe it is. And it's actually in terms of different societies or cultures, it may be more common, again, if there's more injustice in the society. Okay, but this is across the world. Okay, so again, I mentioned about perceived versus objective. So, and even though in the legal world, you mentioned the word injustice, and you may talk about like, is it legally socially defined? But even the legal system, the crucial part is the perception of the injustice. Okay, not necessarily that there's a law from a court that's saying, for example, what's unjust. And of course, again, we're talking often the patient is right regarding that an injustice has been done to them. But the crucial thing is that this injustice doesn't lead to maladaptive coping. Okay, so we'll go on further. A crucial thing in terms of injustice is that the social mediator is the most crucial part. So let's say a person has an injury. Now, if that affects how they are presented to society, if that affects how they're presented to their partner, how they're presented to their workplace, that's called a social mediator. And that's actually the most important part of injustice. So even when you're talking to a person who has injustice, you should look for the social aspect of it. And again, for example, can you improve it? What it means by multifaceted experience is that, again, it affects different elements from physical, social, and psychological. Now, the emotions that occur, the most crucial thing is anger. There's a link between injustice and anger. In fact, injustice equals anger, okay? And sometimes actually the injustice or the anger can be hidden. And again, it's very important to be able to pick up on it, because it will have consequences subsequently in treatment and even in terms of interactions with patients. Okay, now in the past, in terms of research from the pain world, it was believed that pain catastrophizing was the greatest predictor of chronic pain. We now know there's plenty of research to show it that in fact it's injustice is the greatest predictor of whether pain will persist. Okay, so very, very relevant. Okay, in more recent times now, there's more research has come out and it's shown, for example, it's a significant factor in post-operative pain. So again, in terms of there's trauma, and again, if there's a perception of injustice, that post-operative pain will be increased. So, and I'll come back subsequently in terms of how to deal with it. Okay, with injustice, then you most certainly, and I used to once time believe that the biggest problem is attentional difficulties. And what happens is, again, is that the thinking isn't straight. And that is like catastrophizing. Okay, of course, the person will get emotional distress and they'll have maladaptive coping, but a probably crucial thing is relationships. It affects relationships. And it does it in terms of relationships within a family, within society, and very much within healthcare. So a patient who's got injustice is very relevant to the relationships within healthcare. We also know that there's plenty of research to show this, that the perception of injustice, it has a huge impact on mental aspects. So like the mental consequences of chronic pain. We know that, for example, with the injustice, the recovery of the mental aspects like post-traumatic stress will be greatly affected, okay? There's a reference down there, Michael O'Sullivan, and I have to point him out. He's a psychologist from Toronto, and he has done a lot of research and a lot of publications regarding perception of injustice and chronic pain. Again, with the perception of injustice, the pain behavior is increased. So again, they tend to demonstrate this. So again, like almost like demonstrating it to society, increased pain, depression, functional disability. There's increased also protective pain behavior, okay, associated with the perception of injustice. And again, and a couple of things then is that this injustice can go on for, oh my God, it's a very significant length of time into a person's life with very significant consequences for them, for their families, and for their interactions with society. And again, I mentioned the word, the big linking word is the word anger, and a huge effect on recovery. Huge, because again, I mentioned about the greatest predictor in terms of like even the mental distress, but also in terms of even rehabilitation. And the research shows this. If there's significant injustice after spinal cord injury, the rehabilitation is greatly affected. And again, that's the same thing in terms of occupational disability. So how the greater injustice, the longer the person will be out of work after an injury. Here's a paper, again, one of the papers by Michael O'Sullivan, again, who I said is a psychologist from Toronto. And again, it showed, for example, the negative correlation in health outcomes associated with pain. And they also make the point, which I'll be making the point, is that we need to routinely assess for this. We need to routinely assess amongst pain patients regarding injustice. Now, plenty of the studies by Michael O'Sullivan, they came from a pain management program. So again, these patients who came from, for rehabilitation, multidisciplinary rehabilitation, and they did research regarding injustice, and showing again its very significant impact. On my own group, one of the studies we did was simply all patients attended a pain clinic. And we assessed, there's a questionnaire, which I'll show you now shortly, which assesses perception of injustice. And we showed that 30% of our new patients attending a pain clinic had significant injustice, okay? So I'm making, first big point I'm making is that we should be assessing for this. And I think we shouldn't be just simply asking the patient, are you angry? And sometimes actually just remember the word angry can be the word frustration. But really we should be assessing for it formally. Okay, and I'll show you the questionnaire. So I said 31% in that study. Now we've done another subsequent study, and actually 4 years later at that first publication, and now the injustice score was 51% of all new patients attending a pain clinic. The point there actually is that injustice is increasing in the world, the perception of injustice. Maybe different factors for that, changes in society or healthcare, people believe that they can complain, they should complain, okay? But to be fair, it can cause a problem, a significant problem, even with, for example, within the consultation. So again, I've pointed out already about different impact in terms of outcomes. I'm going to be subsequently telling you about its impact within a consultation. Here's the injustice questionnaire, and it's made up of 12 items, and it's scored from 0 to 4. Okay, and actually the relevant score is greater than 28. That is significant injustice if the score is greater than 28. Exactly. It's broken into two in terms of its scoring system. One is into, for example, the severity and irreparability of the loss, but the other part of it is blame or unfairness. To be honest with you, I simply look at the overall score. The score is greater than 28, I take notice. So I pointed out it's the greatest predictor of persistent pain, and it's a big impact on the psychological aspect of it and big impact on the physical rehabilitation. Okay, now let's move on. Here's another concept of it. It's got a big effect on the consultation. Okay. So again, these patients, they come, they have anger. Again, we can use the word frustration. Okay, it's easier for us as doctors to think of frustration than to think of anger. Now, sometimes these patients have previous poor pain outcomes. Now, they'll have poor attention, and quite often that means poor expression. And sometimes they want to prove their injustice, and they'll spend so much of their time trying to prove the injustice. I'll show you subsequently about where the injustice can come from. But again, it's quite common. They'll have poor healthcare relationship. Some people then, when they use the word here, trait injustice, some people are more prone to it than others. And part of also with injustice, they may come with unrealistic expectations. Fix me, doctor. And they expect you to. And again, a part of that comes from the fact about that they feel the injustice. Now, and with the injustice, you have to remember too, it's not necessarily just with the patient. It can be with their accompaniment. It can be with the person who's coming with them. It could be with their partner. And again, that could have, again, a very significant relevance to the consultation, but also in terms of outcome associated with pain. Okay. And we're talking now about the consultation now, okay? And it can be pointed out that sometimes doctors are less well trained than the likes of psychotherapists or psychologists in terms of dealing with this concept of why people have injustice. There's another measure other than the measure I showed you about how to measure injustice, and it's called the Medical Alliance Inventory. And that's whereby you assess the patient's interpretation of their relationship with healthcare, okay? Now, the injustice can come from several sources, but there are studies to show, for example, here's a study again by Scott, which again is linked to Michael O'Sullivan, that the healthcare professional was the highest source of injustice. So again, this may be that they feel they haven't been treated right, they feel they haven't been listened to. The other ones, again, like a family member, okay, or again, for example, if it's a road traffic accident, another person, and here is very low down for the self, okay, they tend to be blaming others, okay. Another concept to be aware of is that, let's say they have their injury, and here's the answer to pain. So it's quite often the injustice doesn't start at that time point. It starts later on, when they're not getting better. And then when other things happen, dealing with a medical legal system, if they find difficulties with communication, if they find restricted access to likes of pain clinics, etc., the injustice comes over time. It isn't there necessarily from the very beginning. And so to be fair to the patients, you need to be aware of this. So this, again, another study by Scott showed the emergence of injustice, okay, with persistent symptoms worsen. And again, sometimes again, if the patient feels that they're not being listened to, or if they're being told that the cause of pain is psychological, okay. So a couple of things then, we're talking here now about the consultations, are very important to work on the relationship. Very important to be non-judgmental, to be non-defensive. So even though if you come across the patient and the way they're expressing themselves is making things difficult, and they come with entitlement, fix me, doctor, work on the relationship. I hear what you're saying. I understand you are suffering. Don't judge them. Again, aware that the injustice it evolves. And again, they may have injustice previous in their life. Sometimes I wrote down here that you can't be honest with them. I need to be nice now, whereby sometimes you have to wait your time. And there's a concept there I've seen there, listening to thunder. And that's a phrase within the Irish culture system. I wouldn't have heard it myself as a younger person, but I'm more aware of it now. And what it means is sometimes you have to listen to thunder that doesn't make sense and say nothing and wait for the thunder to pass and now continue on. Don't react while the thunder is there. And that's, again, just showing you I have an interest in photography and showing you pictures there. You have to listen to thunder. Singing in a storm silences thunder's threats, okay? So don't respond when the thunder is there. And I actually would have photographs like this on my table that the patient won't necessarily see, but I'd be reminding myself that I have to listen to the thunder. So again, we're talking about the consultation. In language, use the language consistent emotion with the patient's communication. So again, if they're using words about the severity, you almost repeat the words. And one of the problems that doctors tend to do, or well, psychologists do too, is to focus on problem solving. Sometimes you're saying back to the patient, oh, that's not such a big problem. This is a problem we can put. That's problem solving, which you're better off to roll with them, to hear what they're saying, repeat it back to them, tell them you're on their side, you're here to listen to them. If others didn't, you will listen to them. Okay? Don't disagree with them. Don't fight with them over what they're reporting as their disability. So there's empathic reflection of the emotional communication. Tell them that you're there for them. And again, you're building the relationship. So again, you validate what they're saying. Sometimes you examine for factors fueling the client's perception of injustice. Okay, and I'm going to show you something about that. So we're going to look for where is their injustice coming from. Another thing then is you need to increase their awareness of the negative consequences of their injustice or of their anger. And then the fourth thing then is about anger management techniques. What have they tried to do? What are in terms to help them with their anger? And you give them some suggestions. Again, examples like mindfulness, or they're doing things to reduce down the emotion. So I've mentioned about validate, to say I'm here with you, we're here to listen to you, we understand, we care. We're going to look at then how do we get the patient's perception of injustice. So there, the language, I can see you've been through a great deal. I can imagine that was a very difficult situation. It looks like your injuries really turned your world upside down. Okay, we're not going to do problem solving. We're going to validate with them. Now here's the examining the factors fueling the perception of the injustice. So what you do is you go straight to the questionnaire, the injustice questionnaire, and you say to the patient, for example, don't say to them, I see that you're angry. You'd say, for example, you've completed this form. Thank you very much. I'd like to ask you a few questions from the form. So on the first item, you indicated that you often thought that people didn't understand how severe your condition is. And then you say, who were you thinking of when you responded to this item? Who doesn't understand how severe your condition is? So you'll get a variety of things. You'll get my GP, you'll get my partner. But again, by understanding this, you know where their perception of injustice comes from. And you can help them. You can say it's very hard for people to understand pain. Or again, maybe even hard for the GP. So that's very relevant. And you even like almost document that will help you. The other second question, again, you look at the global score of greater than 28 being significant. But the other one is here. Who were you thinking of when you responded to this item? So I worry that my condition is not being taken seriously. So again, what do they say? Do they say my doctor? Do they say you? Do they say my partner? And that's relevant in terms of their dealing with the pain. Now, you need to increase their awareness about the negative consequences of injustice or again, anger. So I'd be saying to them, for example, is that this can affect actually relationships with healthcare. And you might say to them, well, how did you get on with your doctor previously? And all of a sudden you say, we got to be careful about that. Because these are the people who are going to try and help you. We need to keep these people on side. And another part of that then is what they call therapeutic alliance. So like, for example, if they have the injustice and anger, will they follow instructions? Will they comply with treatment? And we know that this is affected by the injustice and very relevant. So again, don't be defensive, don't avoid, don't be focused on problem solving, don't come with anger. All this is a waste of time. And again, you sometimes use the word frustration rather than angry, because again, if you say to them, "Are you angry?" Sometimes they're saying they're thinking, "Is this person's thinking that this is my problem is in my head, or is it psychological?" But the word frustration, often it is just frustration. They may have very relevant injustice, harm has been done to them, some injury, some accident, and frustration sometimes is a better word. The anger management techniques, then you can say, you have injustice, you feel angry, what things have you tried? And have you read up about it? Are there techniques that you try? Green exercise, walking. Remember again, the social mediator being a crucial thing of injustice. So I'd make sure that they're going out and they're meeting friends and they're meeting society. They're not hidden away, where again, a lot of the injustice comes from. So there's again another technique to teach them. So all of this is very good. And you do it on the first consultation. And it's going to help you in terms of down the line, where next minute, for example, the anger cause more of a trouble. And again, you might say to them, once we become angry, it feels like everyone is our enemy, but that's not the case. I'm on your side. Very easy thing to say, and definitely helps the therapeutic relationship. Now, here's another aspect, which again, I don't think people would have thought of. And because again, in a consultation, it's not just the patient, there's also the doctor, there's the healthcare practitioner. And the healthcare practitioner can feel injustice themselves, and this can affect the consultation. So again, people are aware of this concept of burnout, and burnout is relevant. A huge factor in burnout is organizational injustice. How are we being treated by the hospital system? How are we being treated by the manager? How are we being treated by colleagues? And now the person will have injustice, and that's very closely linked to burnout. Burnout is normal. They say, for example, again, the longer you're working in a job, maybe it's a bit more common. But just to be somewhere aware of it, and people need to look after themselves. And the injustice or the burnout can have an effect when you're dealing with, you may call them difficult patients, or again, people who have, again, significant injustice. So again, we need to look after ourselves to kind of try to avoid burnout, and we will do better with these patients, all working better. So again, for the doctor, in terms of burnout, you got to look after yourself. You have to have boundaries. You have to know when to say no. Delayed niceness, it's my own concept really. What that really means is you really have to wait for people to ask you to help them. Sometimes there's so much we can do for people. You may have that ability, but you still have to wait for them to ask, because sometimes they won't necessarily appreciate it. A crucial thing as well is, in terms of burnout, is effective communication. If you can communicate effectively with management, with your other colleagues, is a huge factor in terms of dealing with burnout. And again, that is, as I say, in terms of consultation, it's the doctor side of the consultation. Now, I think, as I said, 30%, we did our first study, and subsequently another study, 51%. They're the studies that exist in terms of new patients attending a pain clinic. But I think that we need awareness of it, we need to assess patients for it, but actually we need to practice it. So really, I think you need to do simulation. You could actually get your other fellow work colleague comes in and they start within a consultation and record it. They'll be kind of giving you a difficult time and expressing their injustice. You can use actors, you could script the whole piece, record it. I think that the whole team as well need to be aware of it, from the secretary to nurses. Again, the patient rings up or whatever and here's a significant injustice. You're saying back, oh, I hear what you're saying, we're on your side, rather than getting into kind of an argument with them, or rather than problem solving. Again, you can case review. So again, such a case comes in, you learn it, you subsequently discuss it with your colleagues and what you bring forward. And again, you can use a reflective journal whereby you describe the case, and you maybe describe, you go and do further research on yourself, further communication with the team, and you write down different concepts that you learned from it. That's only showing you an example by the leaflets that we actually give to our patients and actually tell them how the perceived injustice can affect the consultation. Okay, this is research proven. Okay, that is the case. Another thing in terms of dealing with injustice, again, sometimes you can have this discussion with the patients. Some people may not be so comfortable with this, and they might say, okay, leave it to the psychologists, and they might stick to their pain management, be it medications or be it injections. But the other side of it, and some people do benefit by dealing with injustice, and it's very relevant to all of our lives, because again, we do come across injustice. So again, you look back at the religious aspect of it. Buddhism says life is full of suffering. Christianity talks about, in this world you will have trouble. This is a valley of tears. And then they talk about a thing called tragic optimism. It may be a valley of tears, but a lot of good things happen. We stick together. So this is a good approach to, in terms of a tragic sense of life. That's the first lesson. This again, you almost need to teach your children this. The second thing is, how do you respond to adversity is very important. So some people, maybe we all do it, but if you significantly catastrophize, you're actually going to make the problems worse. Greater anxiety, greater suffering. The opposite of catastrophizing may be trivializing. So it's irrelevant. In fact, it's not irrelevant. These things are real, and they're real injuries and real suffering. So again, courage is the first of the virtues, most important of the virtues, because it makes all others possible. So again, if you're trying to get the person to have courage, you may talk about their previous life and previous successes and dealing with injustice, and you can take their interests and their hobbies and their examples of injustice. So again, giving them good example, if you know what I mean. A crucial thing then is like, again, back to is facing adversity with meaning. So again, I would have said that the biggest mediator of injustice is social. how the person is represented to the society and to their friends. So, and the same thing happens then, is it comes with meaning. So if an injury happens to a person, some people, people pass a meaning, oh, bad things happen in this life, but I will survive. One concept there, I know I was taught as a child, is that it has happened to thousands before. Okay, so there's the meaning attached to it. The suffering triggers the search for meaning, which again can cause difficulties, because again, there are no answers to suffering. There are no answers to the problem of injustice. And this comes across all societies and actually all religions. So it's more adaptive to move from why to how to react, or what now. So rather than why, rather than blaming other people, how do I react? What do I do now? And again, you really have to have a relationship built with a patient before you can talk about these concepts. If you talk about those too early on, they will go against you. And now, for example, there's difficulty then with the therapeutic relationship. So again, dealing with injustice, although the world is full of suffering, it is full of overcoming it. And that comes from Helen Keller. She was a Canadian, fairly famous and well known. Now, and of course, a very important thing is have a laugh. Don't take life too seriously. This is a comedian whereby he says, when I was a kid, I used to pray every night for a new bicycle. Then I realized that the Lord doesn't work that way. So I stole one and I asked him to forgive me. So again, this again is in terms of for the doctors, in terms of dealing with burnout, we cope with things better. And again, dealing with these patients who can be difficult. And again, they're come with kind of a blame concept and affecting the therapeutic relationship. So we need to be light-hearted as well. And again, it's about looking after ourselves. That's the point there. Here's an old proverb, Irish proverb. I'm not aware what other societies. The picture here is one of my own photographs. It's from actually placed very close to where we are right now. It's called Mungret. You see the line, which is kind of a photography element. The line is dragging our eye, and here you see a hill behind here. It's actually called Keeper Hill, and you see the different colors, and I've done it in black and white. And the old Irish phrase is, you can curse the darkness, or you can light a candle. So again, it's our approach to it. And again, it's very important for the doctor initially, and it might take a little bit of time to develop the relationship with the patient before you come with this concept. So in summary, injustice is very important. It's the greatest predictor of persistent pain. It has big time affects the recovery in terms of mental health and also in terms of like the rehabilitation. Then it's very important in the consultation. And then I also mentioned the fact about even for us as doctors, as individuals, the concept of burnout. So injustice. And I went through different ways of how you deal with it, you validate it, you teach them different strategies in terms of anger management and how that this injustice has affected them. And then you're even talking, as I would say, the use of humor and the use of any other therapeutic modalities. Thanks very much.
Thank you, Dr. Harman. Thank you, Professor Harman, for the excellent presentation. I think this is a very important topic. I think this is a very important topic. I strongly agree. Many patients are treated unfairly because pain is very subjective and mostly underestimated, especially the psychological part. And I think sometimes we just need to take a break and think as human beings more and show our sympathy and support. I think this is, yeah.
Okay.
So I will be looking for the questions now.
I'm not sure if any question, because if we notice that lecture is outside the usual way of neuropathic pain and all of this stuff, and one of our senior registrar, Georgiana Bozato, Dr. Georgiana Bozato, thank you very much. She did that excellent lecture. And I'm so proud to be working, and actually I know Prof. Harmon since I came to Ireland 20 years ago, and we had been working together in Mother Hospital in Dublin. And when I came to apply for my job in Limerick, he was a senior consultant. Of course, he's younger than me in age, but he's senior to me in work, you know, and I'm so proud working with him. Every Wednesday, he's leading pain management teaching in University Hospital Limerick, and he is excellent colleague and excellent professor of pain and regional anesthesia, and they never stop helping other people to create their career. And he is a leader by example, and I admire him very well as a colleague and as a friend, and so proud for him to be here tonight. And all of you now, Dr. Agamia.
Thank you, Dr. Saad. Thank you, Professor Harman. I didn't get any question. I just got one question for you, if you don't mind. Just one question with the referral. Do you refer to psychologists or a multidisciplinary team with the psychological support, or it's basically just in the clinic that you review them, or do you normally refer them to someone as a part of them?
It depends. I'm a bit unusual, actually. I am a qualified psychologist, as well as a pain. But yes, I will refer to clinical psychologists. Yes, I will. But I'd be used to dealing with this myself. But I will. Yes, there are patients I refer to psychology and psychiatry. It depends on your local resources as well, of course. What have you got access to? And sometimes, like, are you better? Like, so again, so I have this knowledge, and I will deal with it like the same time as I'm dealing with other things. Some people prefer not to deal with it at all and stick with, what they're doing in terms of injections and medications, and then refer any psychology to a psychologist. I'm a bit more comfortable to do some of that. If you know what I mean.
Yeah, it's good to have the knowledge to deal with it.
Just even the knowledge, anyway, like if you do decide to kind of to refer them on, I think the knowledge does help, we find anyway.
Yeah, definitely, yeah. Well, I didn't get any more question. So we should move on, I think. Thank you, Professor Harman. Thank you for being here today.